Now, I'm going to tell you a story. When I was a resident, I think I probably was a senior resident because I had a lot of time on my hands. So I would remember I would always kind of go to my patient's room, just kind of check on, make sure that my patients were all tucked in for the day. And I remember going to this gentleman, lovely guy. And so we were just chit-chatting, telling me about his life. And he said, hey, Dr. Dada, I lost vision in my right eye a few weeks before I came into the hospital. He was hospitalized more for cardiac issues, right? And they'd fixed it and he was about to get discharged. So we were just having a nice little chit-chat. And he says, I lost vision in my right eye. And I'm like, tell me more. And he said, well, I didn't want to tell anybody, but I had this double vision for a while, and then I had these headaches, and then I lost vision in the right eye. And I said, well, how are you feeling now? He said, well, I'm actually telling you this because I'm actually having something similar happen in my left eye, and I feel like I should probably tell someone about it. Yeah, before I lose vision in the eye. And I said, I am so glad you shared this information. And we went ahead, we did some tests, found out we had this GCA, which is Giant Cell Arteritis, which is what can happen in 1 in 10 people with PMR, right? So luckily for him, he spoke up, we treated him, he still has a left eye, but unfortunately, because the gap in the time he reported the right eye issue, we were not able to restore vision to the right eye. So the take-home point from that is if you have polymyalgia rheumatica, you start having headaches, scalp tenderness, jaw claudication, that's cramps in your jaw when you eat, that is an emergency. You do not sleep on that. You call your doctor, you go to the emergency room, they'll treat you and then decide, how to handle it long term. But very important that you report it. Your doctor is going to keep talking to you every time you come in ad nauseum, just because they want to make sure that you don't lose vision, because it is reversible when it is caught early and can become irreversible if there is a delay in recognition. So 3 things, like I said, that will be helpful for you if you've been diagnosed with polymyalgia rheumatica. 1 is don't get anxious. It can be treated. It requires prednisone. There are some other options that your doctor can talk to you about, but this is the basic. And then the most important thing is then protecting yourself from prednisone. So whether it's an exercise program, graduated, we don't want any high impact. Number 2, protecting your bones. So calcium, vitamin D2 is important. And then 3, realizing that there is an association with a condition called GCA or Giant Cell Arteritis that can cause inflammation in the blood vessel to your eye and can put your vision at risk.